In the city of Chicago, the life expectancy of African Americans is alarmingly low. Why is that? What are we doing about it? I'm Sylvia Snowden, and this is Critical Condition. To be clear, infant mortality rates have dropped over the past 2 decades, but Black babies are still far more likely to die than their white counterparts. In fact, according to the 2021 State of Health for Blacks in Chicago report, Black infants are almost 3 times as likely to die in their first year of life than are babies who aren't Black. Why is that? What is it about Black birth that invites these sort of startling disparities? Can we do anything to fix it? Well, to help us work through some of that is today's very special guest. Before I get to her, though, I should say that I'm Sylvia Snowden. I'm a very proud employee here at KNTV, and I'm thrilled to welcome to today's program Tayo Mbande of Chicago Birthworks Collective. Hello, Tayo.
Hi, Sylvia.
I just have to thank you for taking the time to be here to be a part of this discussion. We really appreciate it.
I am more than happy to do it. This is what I love to talk about. This is what I live to kind of make change in. So thank you so much for having me.
Again, it is our great pleasure. So I'm just going to jump right in here. Is there a stigma around Black motherhood?
Oh, absolutely. There's a very long-standing stigma, I think, that many of us are starting to see the health effects of, that many Black mothers did not choose to become Black mothers, a kind of that this is a burden, or a struggle, something that was placed upon us, not something that we willingly or voluntarily entered into. And that misconception of that idea sort of lends us to these really excruciating outcomes where Black mothers are having to sort of defend their position. This is the pregnancy that I want. This is a child that I want. This is something that I have, volunteered for, and I expect to be treated like this is something that's valuable to me.
And I want to do this too. What does that stigma look like when a Black woman walks into a doctor's office pregnant? Talk about some of those perceptions and some of that stigma. What will it look like?
I think there's just an immediate investigation, who has gotten this person pregnant? Is this person in a committed relationship? And really, I think a lot of providers don't acknowledge the fact that they ask these questions implicitly. Is this something that I value? Is this a pregnancy that is important to me as a healthcare provider? If the person presents to be a younger mother or a younger parent, asking questions about, was this an intended pregnancy, or does this pregnancy, is it viable? Is it something that the community should value and hold highly? So I think there is like an immediate investigation of the value of the pregnancy.
Okay, so now you're a doula. So I'd like for you to talk about how you've seen this stigma play out in your professional experience. What have you seen?
Absolutely. So of course, when pregnant people come to us, it is always with excitement. Even if there's a little bit of anxiety or nervousness about being pregnant, we generally have folks reaching out to us for support because they want to have a certain quality of their pregnancy and of their birth. However, when we attend prenatal visits, or even when we get feedback about how these folks are engaging with their providers and the healthcare system broadly, it's not the same excitement that's reflected back to them. There are lots of questions that are asked, and there's almost a assumption of incompetency that these people who are pregnant and who are seeking the highest quality prenatal care that they can access don't have enough basic understanding to be able to make good decisions about their own care. And so I think it translates most often into an assumed incompetency about their own bodies and their pregnancy.
And you're also a mom. Have you seen any of this play out in your personal experience as a Black woman who's been pregnant?
Absolutely. So I have 4 children, and I have, over the course of my career as a doula, given birth to 2 of those children. So it's been very unique for me to be actively working to change these outcomes and then having to experience kind of the lower end of the performance of our healthcare system. So there have been a number of times that I have had to turn certain assessments down because I didn't believe that it was fair that I was being asked to take this test over other folks. And so I was kind of in that sweet spot where I had an easy comparison because I had clients who were pregnant. And so I knew, as a pregnant person, I know that other people are not being asked these same questions. I know that they're not going through so many hurdles to be heard and to get basic quality of care. So I've had to navigate it, which is why I chose to give birth to my last two kiddos at home.
If I can just dig a little bit deeper there, what sorts of questions were they asking you that you thought were just kind of out of bounds?
So I would regularly experience questions about STD testing, which is routine in the state of Illinois. However, any type of examination or assessment can be declined. And most of these routine tests have a very simple and straightforward declination form. And because I've been aware of that for maybe the entirety of my motherhood journey, I usually request those up front. And there was one particular instance where I went to a hospital to get some care in the middle of my pregnancy, and I had a nurse, then a resident, and then later an attending, which for most people, you understand, like that is the highest ranking person that you would most likely come into contact with, ask me why I was refusing to take an HIV test, which in the state of Illinois, it is not required. They ask that you take it, you can decline it. And there are subsequent actions, but it's happened to me a number of times where I have been kind of interrogated on why I'm choosing to decline certain assessments.
So, but I know that you have a background in psychology. Talk a little bit about the psychological impact that receiving that sort of treatment has on a woman who's trying to have a baby.
Well, I say pretty often that the type of stressors that parents are experiencing today is really artificial, because we are not, and especially in these last 2 years, we're not able to engage with community in a way that we need. And so when you are facing this type of pushback and this type of aggression, it feels like early in your pregnancy, you already feel defeated. And so throughout your pregnancy, you are being told, hey, you need to do this, or you're really regarded in a way that doesn't give you power and that doesn't uplift you. And so throughout your parenthood journey, I think it is so easy to fall into this psychological process of feeling that you need approval from other people in regards to how you parent. You need approval in regards to the medical choices that you make for your child. And so it breeds that same type of incompetence, but really a lack of confidence. And so you see a lot of parents who are struggling every day, and then they are living with fear about things that we're seeing nationally. Will my child be taken away from me? Will I be deemed an unfit parent? When really most of us are doing our absolute best. And when you're confident, you are confident to ask for help.
Okay. And when we talk about Black babies dying, talk about the link between the way the mother is treated during pregnancy and then the outcome for the baby.
So there's a really well-known idea called weathering, which is essentially the type of social experience that Black folks and other people of color endure day to day starts to have physical impacts on our body. And this is one of the easiest ways to make that connection between how folks are treated and the actual health outcomes that they experience and their children. There's also a book called Killing the Black Body by Dorothy Roberts, and she introduces an idea called the maternal fetal complex, which essentially separates the two, where we start to regard a fetus as separate from the mother. And because the two are connected, we know this biologically, they are connected. What we do to that mom, we have to understand that that will impact the baby. And so weathering helps us to understand how it will biologically impact that baby. But you'll see that women who are experiencing a lack of communication between themselves and their providers, that they have higher rates of preeclampsia, that they have higher rates of interventions throughout their labor. So an easy example, if I don't feel comfortable sharing things with my provider, maybe I won't tell you that I've had a headache every 3 days. Maybe I won't share with you that there was a little bit of swelling in my feet, because I may actually get anxiety when I see you because of the questions that are asked, or simply because I'm not made to feel comfortable. So it's a really easy connection between socially how my hormones are telling me to respond, and then how my baby is developing and how the rest of my pregnancy is kind of a bit thrown off.
Okay, and I do just want to read some statistics here before we keep going so people can sort of fully understand what exactly it is we're talking about here. In Chicago, Black women die during or within 1 year of pregnancy almost 6 times more often than non-Hispanic white women. 12.1% of Black women receive late or no prenatal care, above the national average of 9.9%. And this information has come from ChicagoParent.com. They did a really interesting piece called Black Women and Babies Are Dying in Higher Numbers. So I want to ask this as well. You know, there are people who are listening to you and I talk who are wondering, well, gee, why would you subject yourself to that sort of treatment as a woman? Why wouldn't you just go someplace where you'll be respected? So what would people like that fail to understand when they're listening to us talk about why we don't just pick up and go someplace else?
Right. The problem is accessibility. So specifically on the south side of Chicago, there are no hospitals that will support the prenatal care that people need. The only hospital on the south side of Chicago that is currently supporting pregnant people is the University of Chicago. And as you can imagine, they are highly impacted, very impacted. So think about how difficult it is to schedule your first prenatal appointment. And so that statistic that you read about seeking prenatal care kind of late in the game is not just by desire. It's not just simply because, you know, Black women are sitting around twiddling our fingers. It's very difficult to find a competent provider. It also is very hard to get information about your provider. And so this is one of the things that folks in the birthwork community are really starting to speak up about, how hard it is to find reasonable reviews about your provider. And so if within my insurance, you know, I have this small pool of options, how can I really be sure that this provider is the one that's going to prioritize me, and really that they have the racial competence to care for me as a Black person? So it's difficult when there are no hospitals that support you in your neighborhood, or the hospitals that do support prenatal folks in their neighborhood have the lowest and poorest birth outcomes.
And do you know what? If you are watching the series, I definitely want you to stay tuned, because we are going to talk all about medical deserts in Chicago's Black communities. But I really want to hammer home what you just said in terms of just the lack of options. I looked it up too, and you're exactly correct. There are minimal options, frankly. Only 4 hospitals on the South Side provide any sort of delivery services. Of course, you have the University of Chicago and Hyde Park that you just named. There's Advocate Trinity in Calumet Heights. There's Roseland Community Hospital, which is far, far south. And then, of course, you have Mercy Hospital, which has had, well, keep watching the series. We'll talk all about Mercy Hospital. But when we get back to the infants and the children, what, again, impact does that have on babies in terms of their likelihood of living?
There are really a number of conditions that can be treated and can be managed from early in pregnancy. And then there are some that can kind of be warded off when you give someone comforting care, you know? And it's not just about what that woman feels. It is truly about how her body is responding. And so if people don't know, this is really what I love so much about birth work, is that this is not some magical kind of idea. Our hormones control our bodies. They tell our bodies to sweat. They tell our bodies to sleep, you know, they tell our bodies to wake up. And so what we experience externally will dictate how our hormones, influx, increase or decrease. So an easy example to understand is if you see a tiger, your heart rate's going to increase, your hormones did that. And it's going to give you enough adrenaline so that you can escape and stay alive. And so when you have these hormones that are fight hormones raging throughout your body, throughout your pregnancy, your body is not able to function at the basic level of creating a healthy pregnancy. And so you'll see children may be born earlier. And so premature birth is a huge issue for a lot of Black birthing people. You'll also see children who may be born closer to their due date, but they have a lower birth weight. And children who have a lower birth weight, they kind of struggle getting those first few feedings together. They struggle putting on weight. And if you deliver a low birth weight baby, then you're looking at spending more time in the hospital. If a mom and a baby are separated and she's having to pump exclusively, then you're probably looking at her producing less milk. So then the baby is not gaining weight long term. And then, you know, it's almost like a cascade of things that could be seriously hampered out if we made sure that women were getting very dignified, humanizing care early on in their pregnancy.
Okay, and one thing that think we're beginning to acknowledge is the fact that a hospital is not necessarily the only place available to a woman if she wants to have a baby. I feel like we are sort of slowly beginning to hear more
Right.
about birthing centers and midwives and doulas. Why don't you talk a little bit about those options and some of the reasons people think they could be beneficial as alternatives to hospital births?
Absolutely. And I love that you bring that up because these things have been around for all of time. The idea of a birth center is not brand new. Understanding that birth is not a sickness. So it makes a lot of sense to have a separate center outside of the hospital where people go because they have serious illnesses. It makes a lot of sense to have someone birth in a space that is conducive to them having an appropriate and safe birth. One thing I like to remind people is that obstetricians are trained in surgery versus a midwife. A midwife is trained in normal birth. That's all they do. They don't care for folks who have unique situations or are considered high risk. And so if you want to have a vaginal kind of normal, typical pregnancy, a midwife is your best bet because 100% of the births that they attend are vaginal births. They do not attend cesarean births. And so you have midwives who can support you at a birth center. They can support you in the hospital and they can support you at home. And specifically in Chicago, we're seeing a huge interest in folks who want to birth at home. But then the other burden or kind of challenge there is that people want providers that look like them. They want providers who understand them.
Are these other options readily available to Black women in Chicago? Like if I wanted to have my baby at a birth center, could I easily do that as a Black woman living on the South Side or West Side, or no?
I can't say yes that you can easily do that because I have personally navigated a lot of those spaces, and I've also supported a lot of people who are trying to navigate having access to the birth center. So in Chicago, currently, there are 2 operating birth centers. One is attached to a federally qualified health center, which accepts most folks' insurance. But there are issues of risk. And so based on where you fall in the category of risk as low risk or high risk pregnancy, you may not be able to birth there. And there are also other small requirements to birth at that birth center. Now, there's another privately owned birth center in Chicago that is operating on a kind of private fee basis. So if you have insurance, they may be able to bill insurance for those things, but most of the times folks are paying out of pocket. And you're looking at about $5,000 to $6,000. The same with home birth. You cannot just, request that the same midwife that sees you in the hospital will see you at home. Hiring a home birth midwife is easily $5,000. That's not on top of the cost of paying for your doula or paying for any other postpartum care after you've had the baby. So it can be very expensive.
So it sounds like Black women are in a situation where they are facing systemic racism in the hospital setting, and then they don't have easy access to other venues through which to have a baby. So what are Black women supposed to do to guarantee that they're safe and their children make it here safely?
It's really tough. And so here you have folks who are becoming pregnant and they're having to strategize on their own. So, at the beginning of your pregnancy, instead of spending this time celebrating or kind of working through some of those anxieties, you are trying to figure out, how can I stay alive? And how can I make sure that my baby has the best chance at living? So we are seeing a lot of folks practice a very radical type of birth where they are preparing to have their babies at home without midwives. And there are tons of folks who are like, hey, this is the most dangerous thing that you can do. And there are also people who say, well, I feel the most dangerous thing I can do is to go to a hospital, where it's shown over and over that folks like me are mishandled. And so we try to be in that middle space to kind of help folks navigate and decide, is this really the best option for you? And if you decide to have your baby in a hospital, how can you make sure that you have the best experience possible? And the easiest one is having a doula, being able to have someone in your corner to run things by, or to let your doctor know, hey, I want to talk that over with my partner and my doula. This is what we do on a daily basis. We answer questions, we provide a context, because the care that you get, it has to be contextualized to you, your body, your experience. And that's not always the case.
Okay, so I just want to stay there for just 1 second, if we may, because I'm curious to know what you'd like to see Black women do to advocate for themselves and they realize that they are getting ready to be parents. What should we be doing?
Absolutely. So the first thing you have to do is recognize that the basic information that we have about pregnancy and birth and postpartum is not going to be enough to carry you throughout the rest of the journey. So you have to be almost as knowledgeable as your provider, as knowledgeable as you can become. And it's difficult to kind of jump out there and know where to start. You don't know what you don't know. And so working with a doula can really point you in the right direction. And we have lots of this information on hand, and we have it in forms, or we can share with you in ways that are easily digestible. So you don't feel like you're a med student, trying to pick up on things that don't really make sense. So a doula can really break things down for you, help you understand what the essentials are. And then if there are other areas of interest for you, if you say, hey, I really want to explore a water birth and I want to know what that could be like for me, a Black woman who has had this many vaginal births, what could that mean for me? Or I want to explore what it's like to have a vaginal birth after cesarean. Your doula can really point you directly where you need to go to say, hey, this is what will really help you. Having that information, that is what's going to allow you to advocate for yourself. Advocating for yourself as a pregnant person is not simply rooted in, saying what you do or don't want. It's really about having an understanding of your own body, of the care that you would like, and these pregnancy and birth phenomena. Can you really play the game with your provider? Do you understand the things that they are kind of touching on? If not, then you're going to be in a vulnerable place where you're not able to make the decisions that your provider can make for you.
Okay, and I want to ask this too. Speak to new moms who maybe have had some bad experiences with the medical system during pregnancy, who may, sort of not necessarily be sure about how to navigate those early years with their children's health. What would you like to see them do to make sure that they do have babies who are able to live, obviously, up and through adulthood?
Yeah, so you have to reflect, look back if you have had a previous pregnancy and birth, and see what areas could I have spoken up for myself, and then what areas did I not have information to do that. We tell women very often, speak up for yourself, speak up for yourself, speak up for yourself, but I have to have something to speak about. So what information were you lacking there? And know that you're not at fault. At the time that you become pregnant, you have the information that you do, and all you can do is try to get more information, try to build a little bit of support. Really not a little, you need a lot of support to do this, but try to build your support system to the best extent that you can, and give yourself patience and grace. The best thing that you can do if you're not sure how to advocate for yourself, what to do or say, is to be honest and say, I'm afraid, I'm unsure, I don't know about this, and I want to learn more about it. And I want time. And practice not requesting those things. Practice telling your provider, this is what I need and this is what I'm going to have to do. We kind of have this culture of our providers being the leaders or the drivers of our pregnancy, where we ask for permission everywhere down the line of our pregnancy, when really you should be saying, this is what I would like to do, and I need to know if I have your support here or not. And it doesn't have to be so aggressive, where you feel like you are creating an enemy out of your provider, but working to really understand, is this someone who will be on my side and who will make pregnancy easy for me? Is my provider someone who will aid me in having a positive experience?
Is there something or anything really that you'd like to say to viewers about this issue that we haven't touched on yet?
I want to share that this is absolutely fixable. So we hear these statistics very often about how often Black women are dying, and then the poor outcomes that we have. Even if it's not death, Black women are still experiencing a higher rate of morbidity, which means that there are just complications that are unnecessary, but they are fixable. This is not a nebulous issue that we're kind of poking at in the sky, trying to figure out, how do we fix this? It is definitely fixable. And you can start with yourself. You can start with the people in your circle. If you know a pregnant person, if you know an expecting mom, ask her, how can I support you? Is there information I can help you get? Can I point you in the direction of a doula? Can I point you towards this support community? And if you don't have access to any of that, affirm her and let her know you're competent and you're capable of making good choices for yourself. Really, I think if we can get a really good home base in our communities where we know where to send pregnant women, what to tell them, we're getting evidence-based and factual information, we can make a lot of change at home before we start attacking what's going on in the healthcare system.
All right. Well, with that, I have to thank today's very special guest, Tayo Mbande, for being with us today. Tayo, thank you. We appreciate it.
Thank you.
Of course, and to everybody at home, thank you so much for staying with us. I encourage you to continue to hang out with us here at CAN TV. We're going to be bringing you a lot more stories that you will not see on any other network. That much I can promise you. Thank you so much as always, and have a fantastic rest of the day.